A popular new weight loss drug now officially getting FDA approval. The weekly injectable called Zepbound suppresses appetite hormones to make you feel fuller longer. Zepbound is the only drug besides wegovy specifically approved for weight loss, but with greater results, making it the most effective weight loss medication on the market. So how does it work and what are the risks? We're going to ask our weight loss physician, Dr. Sue Decotiis. Good morning to you, Dr. Decotiis. Good to see you again. So why do you like this one? This is one of your favorites, right? It's comparable to Mounjaro?
It is exactly Mounjaro, except that it's FDA approved for weight loss. So that makes some insurance companies and doctors and patients feel more comfortable because the FDA has given it its stamp and said, you know, we believe this is effective and safe for weight loss patients. So it's Mounjaro, and it works by inhibiting appetite, by enhancing satiety. But the reason why this is better than Ozempic is that it works on two appetite regulatory centers in the gut that signal back to the brain. And over time, it resets your fat thermostat, which is pretty incredible. And it really helps the way insulin works. When we have trouble losing weight as we get older, hormonal changes, or people that are chronically obese have always had trouble with their weight, many times insulin isn't working well. Insulin has to work well in order for you to be able to burn fat. That's why it's so important.
Any side effects with this?
There are mild GI side effects in the beginning, but the thing that most patients don't understand, they're not being told, is that they have to be really well hydrated. Because when you burn fat, you lose water. So hydration is really important. In my practice, I follow every patient with a body composition scale. And that's so I know where their body fat is when they're starting out, and I watch their progress. So it's basically how they're burning fat. That helps me determine how to dose them and how to taper them off the drug. So many of my patients have lost a tremendous amount of weight, even more than the studies have shown. And they've been able to keep it off, and that's wonderful. But there are a couple of caveats here. I mentioned hydration. Also, there are national shortages. So that's a problem, too. So sometimes people get desperate, and they're searching online. And they may go to an online platform, and that's scary because they might be buying from a bad source.
Absolutely.
It could be totally bogus.
There could be fentanyl in it.
Totally. It could be anything in it. So don't do that. And compounding companies that are able to sell this should not be selling directly to the patient. That's a big warning sign. That's a no-no. It's illegal, and those sites are going to get shut down. They're just going to take your money.
What do you say to the patients that say, you know what, I want to lose like 5 pounds for my daughter's wedding, or I just need to lose a few pounds? Is it safe? I know that a lot of, maybe obese people might want to take this, or if they're diabetics, they say that this is good. But if you just need to lose 5 or 10 pounds for a special event.
Well, my feeling is that it's also about your metabolism. If you're having trouble losing it on your own, it's something to look at. Okay, it's not something just to say, oh, this is not important. I think it can be used for very short periods of time for minimal weight loss if you can't take it off yourself. Of course, you always start with diet and exercise. So it's really important.
What's your favorite out of all of these? Is it the Mounjaro or the...
I think it's Mounjaro, and of course the name is Tirzepatide. But this new drug, Zepbound, is going to be the same thing. So Zepbound and Mounjaro are Tirzepatide. Ozempic is Semaglutide.
Is it changing your patients' lives?
It really is. I mean, people are looking better. We've gotten people off cholesterol medications, blood pressure medications. Also, some people feel they're less anxious. Some patients have been able to get off antidepressants, Xanax, Adderall.
It's incredible.
It's really incredible.
Well, thank you so much for coming on and explaining all this to us. We're all interested in it.
And there's one new drug that's going to be coming out in a year, also by Lilly, called Retatrutide. And that's going to work on 3 receptor systems. I'm super excited about that.
It's incredible.
So that's going to be out within the next year.
Thank you, Dr. Decotiis.